Morning, and depending on where you are, good afternoon, everyone. Everyone's doing well. Welcome to our webinar today. This is classified under our Region Med webinar series, but today we're talking about shockwave treatment for musculoskeletal issues. As I'm talking, please add in your questions, and I will get to them as we're discussing. I have a little bit of material to present, but please just ask your questions and I'll answer them as we're going along. All right, so today we're talking about shockwave therapy for pain and healing. This is a modern non-surgical solution for joint pain, tendon, and soft tissue pain. So today we're going to talk about what is shockwave treatment and how it can help with musculoskeletal conditions. If you think of questions after we're done today, you can always reach us at any of our social media sites or via our website, chicagoarthritis.com. And if you wanted to set up a time to talk, you can always contact us via the website or social media channels as well. Great. So today, we're talking about shockwave because, as a clinic that focuses on non-surgical management of arthritis, tendonitis, injuries, and back pain, we are always looking for what else can we offer patients that is low risk and helpful. And depending on the condition, we find different solutions that may be of utility. And shockwave is one of those that has progressively started to gain more and more interest and attention in the medical community and amongst physicians when it comes to treating various pain disorders, and also in terms of how it can augment some of what we're doing on the regenerative medicine side. So what is shockwave treatment? Essentially, so shockwave, this is kind of shorthand for extracorporeal shockwave treatment, ESWT. This is a non-surgical treatment. Basically, pressure waves are created by some acoustic mechanical energy. Is then stimulates tissue repair, not just masking symptoms, and has been shown to be helpful in various conditions. There is actually a pretty long history of shockwave. This really starts going back to so many things in medicine actually start with some kind of research background, frequently military research background. You look at things like ultrasound, and shockwave kind of comes from that world as well when it comes to sound waves. Starting in the 1950s, 40s, and then eventually the 1960s, you start to see more and more research in acoustic modalities. And so starting in the 1960s, there was some interest in looking at how shockwave treatment can be helpful from a medical standpoint. In the 1970s, late 1970s, the concept of lithotripsy comes out. There's a concept of treating kidney stones, calcified stones with basically acoustic sound waves, that's shockwave. So that is a pretty powerful sound wave. You wouldn't use that same kind of sound wave for musculoskeletal conditions, not to that degree or strength. But beginning in the 1990s, you start to see some early interest in orthopedics, including in things like plantar fasciitis. In the 2010s, you start seeing more studies in musculoskeletal conditions. And now you're starting to see some early studies also in combining shockwave with Region Med treatments for various musculoskeletal conditions as well. So how does shockwave work? Essentially, you're getting a slight bit of mechanical disruption at the tissue level through acoustic sound waves. And what this does is it works in multiple ways. Number one is that it can improve blood flow and metabolism at the tissue level. That little bit of stimulation leads to more blood flow, which eventually starts to cause an activation of the normal reparative mechanism, which basically happens just because there's some kind of stimulation of the tissue and the mesenchymal stem cells at that level. So this activates your repair cells and growth factors that are normally involved in a healing process. So it's been shown to actually help with tendon and collagen remodeling. We know that this can also help with breaking up scar tissue, and if you use a strong enough impulse, even breaking up calcifications. Also has been shown to help with reducing nerve pain sensitivity. The interesting thing is that when you take someone that has either tendon, joint, or ligament issue, what you have is not just that one structure that's affected, you really have all the tissue around it as well. So, as an example, of someone that has osteoarthritis in the knee, it's not just the knee cartilage and joint that's problematic, it ends up being the ligament overlying that, the tendons, the muscles overlying that, some of the small peripheral nerves, the myofascial tissue. All of those structures are involved in pain and stability. And what is interesting about Shockwave is that you are hitting those different levels of tissue as well, which is a very productive and thorough way to treat someone who has a chronic issue. And so I personally find Shockwave to be fascinating because it is treating all those different tissue levels, which we know are involved in pain and dysfunction. In terms of the benefits, what's been shown is you'll find pain relief, you'll find better mobility, you'll find some degree of tissue healing, right? Tissue that's been damaged or tendons or ligaments that have been roughened up over time, you'll see that they have a better look to them over time with treatment. So you get tissue healing support as well. These treatments are non-surgical. You don't need steroids for this. And so they are healthy for the tissue. They're not harmful for the tissue, as some other options may be. And there's limited downtime with this because it is non-surgical. The other thing to keep in mind about these treatments is that because it works along the path of trying to stimulate the tissue that's been chronically either injured, scarred, or damaged, or is in some way not functioning correctly, there's a slow progressive improvement over time. And so that's key because, while there's, for most people, they'll notice some degree of pain relief on the day of treatment, maybe a little bit of discomfort the next day or two afterwards, but then slow progressive improvement over time, which is what we're looking for in the sense that we're trying to get more longer lasting pain relief. So how are we using Shockwave in the clinic? We're looking at this in a few different ways based on experience, based on the data out there. Certainly a first-line option for many tendon and ligament injuries. Not all, but for many of them, as long as as long as tendon and ligaments are intact, I think as a first-line option for treatment along with physical therapy, it's a very nice first-line option. Certainly can help as a non-invasive arthritis pain control mechanism. Again, when you think about it, what is driving pain in an arthritic joint? It's not just that the joint has been chronically damaged, it's that all the other tissues around it have also been irritated and damaged. And because of that, you can actually help treat that full kind of joint complex as well. So it's a very nice option, even first line, for treating chronic arthritic issues. I think for folks who've got chronic pain from various kind of issues, it can be helpful for pain relief as well. Again, as a non-surgical modality, very low risk, and can be very helpful. Can certainly help with recovery after an injury. In general, after an injury, for most people, it's recommended cut back, try not to do too much to kind of aggravate things, and hopefully things start to repair on its own pretty well. As we get older, as an area gets injured, sometimes multiple times, sometimes the body doesn't heal quite as well as it should. And I think anything that can help to improve blood flow, can help to promote that normal healing process, like Shockwave, is a very nice option right after an injury. And then in some cases, this can be helpful as an adjunct in regenerative medicine cases as well. Before I keep on going on, let me just pause for a second just to look at some of the questions that are popping up. Good question. I will answer that question. Someone asking about, does this apply to both osteoarthritis and rheumatoid arthritis? We will talk about that in a moment. It's a good question, though. So common conditions that we're currently treating, or when you look at the literature, where is it discussing areas that have been treated? Certainly osteoarthritis, knees and hip arthritis, lower back degeneration, those are really common areas. Again, my sense is that because arthritis is more than just a joint, it's all the other surrounding structures as well, that I think even treating osteoarthritis in other joints as well can be very helpful. Tendonitis, as long as a tendon is intact, this is still a good treatment modality. If the treatment is fully torn or pulled apart, it's going to be less helpful, but as long as it's still intact, this is still very helpful. Ankles are a great area that can include Achilles tendonitis and the knees, patellar tendonitis, elbows, right? I think tennis and golfer's elbow can be such a chronic and persistent and nagging problem. I think this is a nice way to help heal that as well. Rotator cuff tendonitis, even calcific tendonitis. Normally, if you see calcification in a tendon, normally the calcification is not causing pain. Normally what's causing pain, normally it's just a sign that there's a bit of instability there. There are some cases, however, where calcification builds up so significantly where it starts to cause impingement, in which case Shockwave can be helpful in terms of helping to break down that calcification. Hamstring tendinopathy is another good one that's been described in the literature as well. When it comes to ligament strains, plantar fasciitis is the one that's probably been studied since the 1990s, right? Plantar fascia is kind of its own thing. It's not really tendon, it's not really ligament, it's kind of its own thing, but I think of it almost as like a ligament. Ankle sprains are common, knee sprains are common. Actually, I think shoulder sprains as well, which is pretty common in overhead throwing and lifting activities. Then myofascial pains, when you see people who've got chronic muscle strains, chronic muscle pain from either their activities or because they've had prior arthritic or other injuries in the past, and sometimes the muscles around that area can be chronically irritated and inflamed. This is a helpful treatment for chronic myofascial pains as well. Treatment protocol generally is as follows. It'll be 15-minute sessions, 10 to 15-minute sessions. Generally, we'll do this for about 4 to 6 weeks on a weekly basis to see how you're doing. Understand that benefits will slowly build over time. And the reason why, and that'll go for at least a few months, about 3 months or so. And the reason why is when you're stimulating a tissue that has been previously injured, what you're doing is starting that normal healing cascade. And that starts with stimulation of the local mesenchymal stem cells, which then leads to bringing in other growth factors and other cells that typically looks like inflammation, acute inflammation. That's what happens after an injury. Those cells then bring in other growth factors and eventually cleans up the area, and then eventually starts rebuilding and relayering tissue as well and remodeling. So that takes a few months realistically, and that's actually even over 3 months. That can be even up to 6 months. So there's a slow buildup over time. I think combining this with a good exercise plan, physical therapy plan is essential. When you think about instability, things that you can do on your own from a physical activity standpoint include muscle strengthening. That's very helpful. And then I think combining with orthobiologic treatments or regen med treatments, which we'll talk about in a moment, I think is helpful and I think is the next level in terms of how to get the best result in people. For safety profile, this is a low risk modality. That said, there's no such thing as no risk, right? So in general, these risks are fairly low, but generally Shockwave is well tolerated. You can have some soreness during the treatment. There is a lot of flexibility in terms of how you do these treatments, in terms of how intense the treatment is, how deep the treatment goes. So there is a lot of flexibility in that. So if there's too much soreness during the treatment, you just have to adjust that. For most people, if you adjust that to a level of tolerable kind of discomfort where it's not really causing pain, but it is sort of causing some stimulation to tissue, for most people, it is tolerated during treatment. There can be some inflammation and discomfort for a couple of days afterwards, but you should be able to resume your normal activity that you're able to do at that time. So what I mean is, let's say you've sprained an ankle a month previous and you really limited your activity, but you can still walk, do some light exercises. You'll be able to continue to do that level after you leave treatment. But over time, that will progressively improve and pick up. So time to be cautious. These are not really specific to Shockwave, but And some of these are kind of obvious, right? Like if you have an infection at the site of injury, would not make sense to be doing anything around that area. That's kind of obvious. So let's say you have an ankle injury, you also have to have an ankle sore for whatever reason, right? Let's say you're a diabetic and you have an ankle sore. Obviously, you would not want to do shockwave at that moment. Although some could make an argument that in someone who has chronic vascular issues and an ulcer there, more blood flow can actually be helpful. But in general, you want to avoid if there's an infection there. Pregnancy, kind of just a common sense issue. I mean, if you're treating someone's ankle or knee or shoulder and they're pregnant, probably low risk, but it's one of those things that you'd probably avoid in that kind of circumstance. If you have a pacemaker, right, probably not a big deal if you're treating down in the lower extremities, but if you have a pacemaker in your left chest wall, you probably would not want to be doing shockwave over the left shoulder or something like that, where you might accidentally cause a pacemaker to shock you. Again, really rare things, kind of common sense things, but generally very low risk kind of treatments. I see questions coming in, and yes, I will get to these for sure. In terms of candidates, I look at a few different things. I think for most degrees of osteoarthritis, this can be helpful in terms of pain release. For tendon issues, again, as long as it's not like a full thickness tear, still treatable with shockwave. Ligament strains, again, as long as it's not a full thickness tear, still very treatable. Post-injury, I think this is a nice option as well. A lot of times people will have, sometimes when we say injury, sometimes we think, oh, it's the first injury. And, a lot of times people have recurrent injuries, right? So like if a shoulder is a little bit unstable from prior activity, like you're a tennis player or a baseball pitcher when you were younger, and now that shoulder is a little bit more unstable and more prone to getting injured, well, that's not really an acute injury. It's kind of recurrent injury. But, I think as a post-injury modality, it can be very helpful as well. So someone had asked a question about, well, what about rheumatoid arthritis? For inflammatory arthritis, if you have like acute inflammation of a joint, I don't think this is the right modality for that, right? Like I think the issue is more one of, hey, you've got inflammation, that has to be treated. On the other hand, in folks that have, let's say, a history of inflammatory arthritis, rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, let's say their inflammation is controlled, but they still have some discomfort over a joint or two because that joint has been previously irritated, previously damaged, well, then that's a joint that can still be treated for sure. So if there is some degree of chronic wear and tear osteoarthritis because of prior inflammatory arthritis, yeah, that can still be treatable. From the standpoint of, acute inflammation, I don't think this is the right modality. A lot of things in medicine are timing, meaning use the right tool at the right time. And I think shockwave in the setting of, let's say, an acute RA flare doesn't quite make sense. But in someone that has controlled inflammation, but they still have a little bit of chronic discomfort, this can still be very helpful. So somebody asking about experience with RA treatment with shockwave in the early stages. I still think you have to treat the overall inflammation first. But again, as an adjunct treatment, this can still be very helpful. Okay, someone else asking about, can this slow OA progression or heal it? Which stage could it not help? I feel it could replace injection, not the surgery. Okay, so yeah, I mean, I don't have evidence to say whether or not it can slow the progression of osteoarthritis. All right, I think from a common sense standpoint, I think it can be still helpful in terms of pain. I think if you're in an early stage, that certainly makes sense. I even think if you're at a more advanced stage, it can still be helpful from a pain standpoint. However, if you have, let's say, could this prevent the progression? I just don't have data to say that really confidently. And can it like reverse, let's say, something that's been slowly going on for years? Again, I think that's probably beyond what the modality can actually do. Somebody else asking about what if you're on a blood thinner? Really good point, right? I just think you have to be cautious if you're on a blood thinner, right? I mean, if you're on a blood thinner, you're more prone to bruising and bleeding. For most areas, I don't think that's such a big deal, right? Like if you're probably more likely to get bruising in the area that's been treated. I think you just have to be cautious and be aware. I think if you're someone who bleeds really easily, I think then your provider just needs to be aware. And so let's say you're treating something like a knee or an ankle, it's not such a big deal, right? Let's say if you're treating a hip, just want to be cautious, right? There's some bigger vessels at the hip level. So I think just being aware of it is fine. I don't think you necessarily need to do anything. Just know that you may have a bit more bruising afterwards. That would not be surprising. I would expect that. Somebody else, okay, I'll get to this question later. Somebody else asking about more advanced osteoarthritis, getting a regen med treatment, and then using this as an adjunct. We'll talk about that in a moment. Good question. Okay, good. There we go. So Shockwave plus regenerative medicine. So amongst physicians who do a lot of regen med, all right, there's a ton of interest in Shockwave. And the reason why is because just over time coming to realize that some of the things that make regen med really interesting, Shockwave has some of those properties as well. So namely, how are we, there's this concept of prolotherapy where if someone has, let's say, knee arthritis, you're not just treating the knee, you're treating all the supportive tissues as well. So that is a concept that works very well with regen med, that people will do better over time, even if they have more advanced disease, if you're treating not just a joint, but all the other surrounding tissue. All right. And the reason why is because if you can strengthen and support that other tissue, the person will have a stronger and more stable overall functional unit of a joint, which will give better stability, reduce inflammation, less pain, better function. All right. So Shockwave works in a similar concept as well, because you are trying to treat all the different depth and layers of treatment. So if you're trying to treat someone that has osteoarthritis in the knee, you are, by the nature of what Shockwave is, you are treating the skin, the myofascial tissue, subcutaneous tissue, muscles, tendons, ligaments, all the way down to the joint. So like you are really treating all those different layers. And it works slightly different than regen med does. So it comes from a similar process and concept, but it's also synergistic in the sense that it's working in the same vein and in the same idea of trying to strengthen the overall functional unit of a joint. So it's synergistic, which is what makes it very interesting for regenerative medicine physicians. What we're recommending is really as follows. Pre-treat the area, meaning you're sort of preparing the tissue in advance, right? Whether it's tendon or joint, you're trying to put a little extra blood flow, get it a little bit more stimulated, makes it a little bit more receptive and open to what you'll be delivering in terms of cells, whether it's your own blood platelets or bone marrow stem cells. Post-treatment, help to enhance your orthobiologic treatment, your regen med treatment, in terms of helping the tissue to stay stimulated, as well as to help you recover from treatment as well, which is a key part of this. And part of that is because with regen med, there is more inflammation up front. And sometimes those other surrounding tissues can get aggravated, and Shockwave can help to calm down some of that. In the end, this is all very still individualized, meaning, the protocol you use for one patient is a little bit different from patient to patient, depending on what you're treating. But I think Shockwave, when it comes to regen med, has a lot of exciting potential and is partly what we're recommending now as well. You're welcome. My pleasure. Someone just saying thank you. Okay, seeing thumb and index fingers. Yeah, Shockwave may still be beneficial, right? I think in your case it was osteoarthritis. Shockwave may be beneficial in that case. Just needs to be reviewed, kind of figured out like what's the degree of damage and how much is joint, how much is tendons. Meaning, is it more specifically over the joint? Is it a little bit more over the tendon? Like, just depends on which structures are being affected. but still can be very effective. Just a couple sort of resources for articles that have been published over the last decade in terms of shockwave and musculoskeletal health. Again, you can go further back where there's data that's been kind of progressively coming out about these treatments for some time now. Key takeaways from this are shockwave has an important use in the treatment of arthritis, tendonitis, injuries, and back pain, in that it works for treating the overall joint and tissue that's been chronically injured. Strongly always recommend trying to maximize your non-surgical options for your musculoskeletal health. Shockwave really does fit into that paradigm. And again, I think when it comes to your non-surgical options, you always want to try to use things that are going to be helpful for the tissue long term. So we always try to get people to minimize how much steroid injections they're getting, how much anti-inflammatory medications. Try to utilize the treatments that are healthy for your tissue long term so that you can get a better long-term outcome as well. Good question. Somebody asking, they had a regen med treatment in the last couple of months. Could shockwave still be helpful? Absolutely, right? Like I think as you're talking about the overall remodeling of tissue and strengthening of tissue, still very helpful in terms of treatment of that. Keep in mind that, again, when you think about, I can't remember exactly what area you had treated, but, keep in mind that you take most joints, right? Like there's a lot of different structures that are really involved. It's really quite amazing how the human body is built, in that it is so many layers of tissue that are involved. And so as much as we try to be thorough in our treatment, there's always a little bit more refining that can happen. And I think shockwave helps to refine some of that in terms of treating some of the residual issues that may still be there. And keep in mind with the regen med treatments that there is a slow improvement for several months, depending on which treatment you're getting. And shockwave still fits in that, even if you're talking a few months down the line. Really good questions. Let me just quickly check to see if there's any questions at any of our social media sites that are streaming as well, or if we've answered anything. Okay, good. Well, listen, everyone, I appreciate your time. If you'd like to learn more, you can take a picture of our QR code here. That should take you to the website on Shockwave on the Chicago Arthritis website. We can be contacted if you have questions or would like to learn more or would like to be considered for evaluation or treatment. You can contact us either through the website, our email, which is listed there, admin@chicagoarthritis.com, or any of our social media sites. And you will get a copy of this webinar in replay after we post this in the next probably 24 hours. You can either watch it again or share it with any friends, family, or colleagues that you think would benefit. So thank you, everyone, for your time today. I'm sorry, hang on one second. One last question here. Not sure I quite understand. Somebody asking about this helps to treat the tissue or repair the tissue that's been damaged. That is correct. It does not necessarily irritate the nerve, right? Like a lot of those small little peripheral nerves that do get irritated in a chronically arthritic or tendinopathic area, a lot of times there's tiny little small little peripheral nerves that get a little bit pinched or irritated, and shockwave can actually help with some of that as well. So it does not irritate the nerves. There's a little bit of soreness just from causing some stimulation of the tissue, but should not really irritate the nerves beyond that. Yep, you're welcome. Okay, good. Well, again, thank you, everyone. Appreciate your time, and hope everyone stays healthy and safe. And until next time, have a good day and live well. Bye-bye.